Hello and welcome to Live Healthy, Live Well, West Virginia. I'm your host, Dr. Lisa Costello, a pediatric hospitalist and assistant professor of pediatrics at the West Virginia University School of Medicine. My guest today is Dr. Kara Pachowski. Dr. Pachowski is a clinical pharmacist who is also a medical student at the Marshall University School of Medicine. She is joining us today to discuss tobacco cessation. Welcome to the show, Dr. Pachowski.
Hi, Dr. Costello. Thank you so much for having me.
I'm so grateful to have you here so that we could have this discussion for our viewers and those who may be seeing this in a variety of different ways about tobacco cessation. And we're going to get into, what does that mean and what are some resources that are available. And you've done work in this area. Why don't you tell our viewers a little bit about the work that you've done in regards to tobacco cessation?
Sure, absolutely. So tobacco cessation is a huge passion of mine. Like you mentioned, I previously practiced as a pharmacist for a couple years and still a practicing pharmacist. And in that career, something that I did extra was tobacco cessation counseling and started my own group class. So a little bit of background from my qualifications. I'm a certified tobacco treatment specialist. So I've had specific training on how to talk to people about quitting tobacco and how to lead a group class. And so since I was in pharmacy school and now transitioned into being a medical student, I still operate a website, a nonprofit organization called Tobacco Free Me, and run a group class to help people quit tobacco.
That's wonderful. So you're certainly an expert in this area. And I think it's so important. And to take a step back, we're going to talk about tobacco cessation, but I think we have to first talk about tobacco. And tobacco is used by many, many people, and probably someone watching this, someone who uses tobacco in some form. You yourself may use tobacco. So tell us a little bit, Dr. Pachowski, about, what are the risks of using tobacco or tobacco products, and how do they impact our body?
Yeah, absolutely. That's a great question. So the main component that makes most tobacco products so addictive is a substance called nicotine. And nicotine has its negative effects by itself. It can cause increased blood pressure, it can affect your blood vessels. But the other things that are found in tobacco products are what really make them so harmful. So there are things in cigarettes and other forms of tobacco products like tar, carbon monoxide, different harmful chemicals, even formaldehyde, that have a strong association with all types of cancer. So not just lung cancer, but really any type of cancer. And that's not where it stops, unfortunately. Tobacco products are incredibly harmful on really just from head to toe when you start thinking about it. It can, of course, affect your lungs and can lead to heart disease because it affects your blood vessels. It can cause strokes. It can cause COPD in your lungs. And so not only is cancer a huge risk, but pretty much everything from head to toe, tobacco products can increase your risk of, unfortunately.
Yeah, and I think that's a shift, because I remember my grandparents talking about, in the past, people didn't really understand the impacts of tobacco and all the different substances that might be along with tobacco. And nicotine is one of the most addictive substances out there, and that's why we'll talk about how to help people if they started using and they want to quit. And so I think it's important to think about tobacco really isn't just cigarettes, I think that, or those combustibles. I think that a lot of times people might think that's the only place that we find tobacco, but really we've started to see an uptick in other products, electronic cigarettes or vaping, and there's other products that contain tobacco. So talk to us a little bit about that, because I think sometimes people might not realize that they're being exposed to tobacco if they're using a certain product.
Yeah, absolutely. So I will probably say cigarettes a lot when I'm talking throughout this segment, but unfortunately, the scope of tobacco use and tobacco products actually continues to expand. You would think it would be the other way around, but it's actually expanding, just like you mentioned, especially targeted towards our children these days, our younger folks. We see e-cigarettes or vaping products. These a lot of times are flavored liquids that still commonly you inhale, that even if they say that they don't have nicotine in them, studies have shown that even those that claim that they're nicotine free actually have nicotine in them. And so that's what makes them so addictive. So even the new e-cigarettes and vapes have a really high nicotine content, most of them. So once people start using these products, it's really hard to get off of them. And we can talk more about why that is and what happens in our bodies when someone uses a cigarette or an e-cigarette, why it's so difficult to quit. But it's very similar, extremely difficult to stop once you start. And we're finding more and more information coming out that these electronic cigarettes or vape are still extremely harmful to the body. We can talk a little bit more about that later, but they're definitely not safe. And so we can kind of dive into why that is shortly. But they sometimes are marketed as an alternative to smoking cigarettes. And while there's some information to show that it can help people stop smoking cigarettes if they switch from cigarettes to electronic cigarettes, while that could be helpful, the risks are still there with electronic cigarettes. So it's not something that I ever recommend. And we can talk a little bit more about that later. But there's other things too, not just electronic cigarettes and vape, but also smokeless tobacco. We see a huge population of people who use that in our state of West Virginia, especially. And so these are things like snuff or dip, where you absorb nicotine through your oral mucosa in your mouth. And surprisingly, these can have the highest nicotine content. So if you know someone or you use like snuff yourself, some of the different brands of smokeless tobacco have the equivalent nicotine in one can as 4 packs of cigarettes. So the nicotine content across all these different tobacco products varies tremendously, but the common theme is it's always there because it gets people coming back to use the products and stay kind of addicted to them, unfortunately.
You did such a good job of explaining that, and our viewers know, and I introduced at the beginning, I'm a pediatric hospitalist, so I take care of kids in the hospital, and I've taken care of kids in the hospital with lung disease or e-cigarette associated lung injury, and it's always the look on their face of the shock of, oh, I didn't think this was harmful, or I thought this was better than combustible cigarettes. And as you said, if you've ever walked into some of these stores, it looks like a candy shop, and a lot of it is marketed or directed towards kids and teens, because if you're able to get started early because of that addictive potential that certainly we'll dive into a little bit more, that keeps you hooked. And so the earlier you start, the more likely you would be to continue on for a long time. So I think it's one of the things you said that I want to kind of talk about next is, I think when the e-cigarettes came out, I heard from a lot of people, friends, patients, people in the community, oh, well, these are better than cigarettes, and this is why they're created, or this is better than cigarettes. So maybe talk to our viewers about that, because I think and I've experienced this with the case I just shared about, and I have a few of those cases of people really didn't think using those e-cigarettes were going to be harmful. So share with us a little bit about that. Are these, you touched on a little bit, but expand more about these e-cigarettes and really if they're all that they're marketed to be.
Sure. It's a great question, and something that even more and more research is coming out, and we still need more. But just to start off, like I mentioned previously, e-cigarettes and vape, there is some data to show that if you smoke regular cigarettes, these can help you get off of those regular cigarettes and at least not be smoking regular cigarettes. That could be helpful, but that's not anything I ever recommend, because what we found is that once you give up regular cigarettes, now you're addicted to these e-cigarettes. And these e-cigarettes, like you mentioned, are absolutely not harmless. And I think that the companies that market these products fail to mention those details. And so I can talk a little bit more about that. So, just like you mentioned as well, these are kind of marketed a lot of times towards kids. They're flavored. The industry is starting to try to crack down on those different types of flavoring, so it's not so targeted towards kids. But absolutely, when they first came out, that was how they were marketed and still are to this day, unfortunately. And so, in West Virginia specifically, we have a really high rate of our teens using electronic cigarettes or vape. And so it's definitely a problem, because as more information comes out about these products, we are finding all the negative health effects that we previously saw that were unknown about regular cigarettes as well. So we're kind of uncovering new information as these are on the market for more and more years. Because until just a couple of years ago, electronic cigarettes and vape were not monitored at all by the FDA. And so any claim that these companies made about these products, unfortunately, were not backed by any scientific evidence. And still to this day, as the FDA continues to monitor and find out more information about these products, we're learning that more and more things are included in these e-cigarettes and vape that we were not told from the beginning that they were in there. So things like tar, different oils that are used for flavoring can cause really bad damage to the lungs. Nicotine, of course, really high concentrations of nicotine that keep our kids wanting and coming back for more because they're so addictive, are in these products and not well monitored and not well displayed on the package. If you've ever seen a package for an e-cigarette or a vape, it's really hard to find any information of what's in there. And so just the design of them is kind of flawed in that we don't always know what's in the products, and they're not always required to tell us. So that in itself is a problem. But also more and more data is coming out on the true harmful effects of these different e-cigarettes and vape. So like I mentioned, different chemicals are in them, but we're also seeing clinical data that shows that kids especially are at increased risk of lung disease. So there's something called popcorn lung. It's thought to be from the different oils and other chemicals that are in e-cigarettes that can cause significant lung damage. I mean, you've probably seen it in the hospital. Our kids get admitted and have to be taken care of in the hospital. That's how bad it can be. They're also tied to increased risk of heart disease and increased risk of stroke, just from just a couple years of data. So as we see these products being used for more and more years, we can probably expect that more and more negative clinical data will come out to show us that these are not safe.
Yeah, and I think, I mean, I've seen this, and I, have these experiences, and again, the families are usually, kind of a little shocked that their child, their loved one, or they themselves, I've had the teen themselves being like, I never thought that I would get this sick, and it's really, it makes it really hard to breathe, and I've had patients that have, needed to go all the way to the ICU. So I think that was a really good, background on kind of the state and why these products could impact our body in not a good way. And so I want to kind of go into now the work that you've talked about with tobacco cessation and, why, so someone has started, and a lot of times people start for different reasons. And so, why should someone consider quitting using tobacco? Are there health benefits to that?
Yeah, definitely. So if you smoke cigarettes, or really, we can kind of extrapolate this to use of any tobacco products, the single best thing you can do for your health is to quit tobacco. That's how harmful these products are, especially cigarettes, for all the reasons that I previously talked about. And the good thing is that if you quit, we see the benefits of quitting tobacco almost immediately. So, literally within days, people who quit smoking start to feel better. Their lungs feel a little bit more clear. That kind of cough, that's chronic cough that tends to come with smoking cigarettes, starts to go away within days. And then if you extrapolate that out for months and years, the risk of all those things that I talked about at the beginning, cancer, heart disease, lung disease, goes down to an equivalent of someone who has never smoked before, years down the road. So we see a good timeline of immediately when you quit smoking, benefits are seen. You feel better almost immediately. But the long term benefits of that decreased cancer risk, heart disease, lung disease, strokes, we see within years of quitting. So, really, the benefits are, I know it sounds a little bit cliche, but quite endless. And again, it's the single most important thing that you can do for your health is to quit smoking.
And that's what I've shared with friends or people, when individuals find out that you're in healthcare. Hey, what can I do that's, the best thing for my health? And I tell people, if you smoke or use any type of tobacco, stop. And if you don't,
Hmm.
never start. So
Yes.
I think it's important. It's hard, and I think we both have had those experience of patients who have started and then they say, I do want to quit because of the impact this is having on my life. So, but it's so hard. Why is it so hard to quit using tobacco?
Yeah, that's a really, really good question because uh, it's so hard to quit, not on the individual person. Cigarettes and tobacco products are literally designed to keep you coming back for more. So when I talk in my class, I always talk about there's a balance of why quitting tobacco is so difficult. There's the addiction side, which I'll talk about in a second. That's the nicotine, makes you want to come back for more. But then there's also another side that is just out of habit. So what happens is people smoke for many, many years, and not necessarily do they even have a craving for a cigarette, but their smoking behaviors just become automatic. So they wake up in the morning, they've smoked for maybe 15 years, let's say, and they might wake up not necessarily thinking, oh, I have a craving for a cigarette right now, but it's just automatic. They get up, they smoke a cigarette. It's almost ritualistic. It makes them feel good in that way because it's just a habit and part of their day than it is necessarily being addicted to the nicotine. But the addictive substance nicotine plays a huge part of why it's so difficult. So, like you mentioned, nicotine is actually one of the most addictive substances. Um, why that is because when you either inhale nicotine through your lungs or use it really any other way, it's very rapidly absorbed and immediately starts working on the feel good chemicals and reward center in our brain. So it works super quickly, it's very strong, and that kind of almost automatic euphoria of starting to feel good as soon as you smoke a cigarette is why it's so difficult and why your body wants more once you take it away. And so you are fighting against that addiction side of having a substance in these products that is just really hard to beat because it's so addictive and makes your brain, literally alters your brain to make you feel like you need more. And then you also have the side of the habit of once you start falling into this feels good. Really, I shouldn't even say falling into, because it's really not your fault. It's designed to be this way, and you really have little control over it in your brain. But what happens is once the addiction starts, it becomes a habit as well. So when you eat a meal, immediately you go to have a cigarette. When you wake up in the morning, when you read the newspaper, whatever your trigger might be, it almost becomes an automatic behavior. And so that's why it's so hard to break away from both sides of using tobacco.
Yeah, it's really like almost stacked against you because you're just wanting to come back for more and more. So when someone says, "Hey, I think I want to quit. I know that this is impacting me," they may feel it themselves. I've had a lot of patients say that, "I want to stop this," or as you mentioned, they may not realize that the symptoms they're having or the feelings they're having are because of their tobacco use. What's really the first step a person could take? And then share with us what are steps individuals can take so that they can, quit using tobacco for good?
Yeah, absolutely. So this is where all my training and previous work kind of comes into play. I think the first I want to just quickly mention, if I haven't already, that people who use tobacco generally really want to quit. So over 70% of people who use tobacco want to quit. So that shows you how addictive it is and how much people want to quit but can't. But that's good because that means that people are ready. So I think step one is just the thought that quitting would be good for me. You don't even have to commit, but if you start having some change talk of quitting would be good for me, I think this would be a good idea. I think that's step one. And I think most people are already there. And so once you're there, the next step is to start planning of how to make this real. And I think what happens is a lot of people jump in too soon. But what I want to do is encourage you, if you are a smoker, if you use tobacco, to pick a date that you want to become smoke free. I like to use the day that you want to be smoke free, in addition to quit date, either one. But I kind of like that term. And pick that date and be ready to plan for it. It can't just happen overnight. I would not encourage you to pick your quit date as tomorrow because you need a lot of dedication to getting ready to quit, which I can talk more about that. So pick a date in the future. And there's all kinds of tools that we can use that I'll talk about and go through that can get you there and make you ready once you pick that quit date. But the other background things that might be helpful is to get support. It is very difficult to quit. Most people probably already know that. Uh, so I encourage people not to go at it alone, whether it be kind of formal process like calling the quit line, enrolling in a class, doing something like that with their provider. That's great. But another really important piece, if you even don't want to go down that route, is to let your friends and family know. It is amazing how much support you can receive from your close loved ones. They are probably wanting you to quit as well. And so once you pick that date, let people know about it. Tell your friends and family. It helps keep you accountable. But more importantly, it sets you up for receiving support. And so those are kind of the two quick things that I recommend off the bat is pick a date in the future, be ready to plan for it, and get support.
Those are such great tips, and I think it's really important. I think a lot of times people talk about like, oh, I'm going to do this like cold turkey, or that's kind of the
Mm-hmm.
phrase, I'm going to just stop. And certainly there are people out there who have that success. However, I think we know that that's probably not the best strategy for long-term success. So you mentioned some of the different tools. So talk to us about those now. I mean, the medicines that are available, I think there's maybe
Mm-hmm.
even like nicotine replacement. So share with us, what are those tools that you referenced, including, maybe medicines that are even available to help a person quit?
Yeah, absolutely. So after picking the quit date, the next thing to do is to get ready for that quit date. And one thing that I recommend so highly is to use the medication tools that are available to you. So I do have background as a pharmacist, but even if I didn't, The data shows that the different medications used to help people quit tobacco increases their success of quitting by 3 to 4 times. So cold turkey, like you talked about, is just saying you're going to quit and you just give up cigarettes without a second thought, no real, not using any medications or anything like that. And that could be successful for sure, but you increase your success if you use medications. And what these medications are, there's a couple different ones. So I'll talk first about the medications that you can buy over the counter. So you don't need a prescription for them. You can walk into a drugstore today and buy them off the shelf. These are nicotine replacement products like the nicotine patch, which is something that you wear on your skin, the nicotine gum that you chew and kind of park in your cheek, or the nicotine lozenge, which is kind of like a cough drop that has nicotine in it. And so I highly recommend these. They are effective. They are easily accessible. They can be, they do cost money, but when you kind of compare that to the cost of packs of cigarettes, it's equal or less. So these medications, what they do is they provide a little bit of nicotine throughout the day that keeps cravings low for a cigarette. So the patch specifically, you wear it for 24 hours and it constantly gives a little bit of nicotine into your system. And that helps prevent cravings throughout the day. In addition to using that patch, you can also use the different gum or the lozenge on top of the patch when a strong craving comes. So you can use them in combination. And that's actually how I recommend using them because it's more effective that way. So if you use the patch long term, it gives you nicotine throughout the day. And let's say you have a really big craving for a cigarette, you can pop in a piece of gum that gives you a little bit more extra nicotine in that moment to get through the craving. So I like using those combination products. Other things exist as well, prescription. So you need to see a doctor, you need to get this prescribed for you and pick it up at a pharmacy. And these also include different types of nicotine products, like the nasal spray or the Nicotrol inhaler. So it's kind of like a puffer that delivers nicotine as needed. Those are prescription. And then there's also pill medications that you can take that are under the supervision of your doctor, your primary care provider, or whatever physician. And these medications include bupropion, which is a type of antidepressant, actually, that kind of helps work on those chemicals that we talked about of why nicotine is so addictive in the brain. So it helps with that. Or the other medication is called varenicline, or you might have heard it called Chantix, is the brand name. And what this is a pill medication that you take that kind of really curbs the cravings of nicotine because it mimics the nicotine molecule.
Wow.
So
yeah, there's so many resources out there, and
yeah.
I mean, and thank you so much for, I think we will certainly have to have you back to even discuss more, because there's so many resources out there for people who may have started and then want to quit. And I think, you know, we've been sharing some tools throughout, including the website that you mentioned that you manage, and encourage people to pick that quit date and always call 1-800-QUIT-NOW. So I want to thank you, Dr. Pachowski, for joining us today and for all of your ongoing work to help people lead healthy lives. And thank you all for tuning in to Live Healthy, Live Well West Virginia on the Library Television Network.